Hello, I'm Dr. Robert Lelouch, a board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about pyelectasis, or dilation of the kidney in your baby, in your fetus, before it's born. This is a finding that you might be alerted to on ultrasound. Good news is most of the time it turns out all fine and not of serious consequence, so the overall prognosis is very good in most circumstances. It's something that needs to be followed. It generally occurs more often in boys than girls. So let me give you a little background. The kidney, you have two kidneys, they filter blood, they take toxins out and create urine. And the urine collects in the center of the kidney in what's called the renal pelvis. Looks like a little triangle. And then out of the kidney are these tubes called the ureters that go down the body and enter into your bladder, and your bladder fills up and holds your urine until you have to go pee. Now, babies make urine, their kidneys make urine, and they do pee inside, and that's the largest component of amniotic fluid. So yes, the fluid inside of you is baby pee, mostly. It also comes a little bit through the placenta, some fluid exchange through the placenta, okay? So, when you get an ultrasound, sometimes the kidneys early on are hard to see, but they can see that pelvis, that little shape, as a little bit of fluid. And if that diameter gets large enough, a few millimeters, they might say it's a little dilated. And that's what pyelectasis is, which is Latin for kidney dilation, okay? So if it is a little enlarged, it might mean the entire tract of the kidney, ureters, bladders is not as well developed, or it might mean there's some obstruction in the ureters, or it might mean there is some backflow from the bladder up to the kidney. So those are generally the causes. Again, it happens more often in males, and if it gets severe enough, it might cause damage to the kidney. It rarely ever does. I cannot remember a case, and the 30 years I've done it, where any intervention was needed until the baby was born. That intervention might be antibiotics to help clear up an infection, or it may end up being some surgery to repair or clear an obstruction. But it is something that is followed to make sure how it progresses and that it's not getting too significant and not damaging the kidney. So again, take-home messages, something to follow on the ultrasound. Look at it this way, you get more ultrasounds to look at. But most of the time it all turns out okay, and it's just a little follow-up after your baby is born. So I hope you found this information of value. Please leave your comments. Thank you.